According to the Center for Disease Control and Prevention, also known as the CDC, accessed on July 17, 2013, more than 35% of U.S. adults and approximately 17% of children and adolescents aged 2 to 19 in the United States are obese. Since 1980, obesity prevalence among children and adolescents has almost tripled. According to my audience analysis, 80% of students answered that obesity is a lifestyle condition and not a disease. Well, as of June 18, 2013, the American Medical Association, also known as the AMA, has classified obesity as a disease requiring a range of medical interventions. As an exercise science major, I would consider myself pretty familiar with the topic. Within this speech, I'm going to cover a few important points: how obesity is defined, why obesity is classified as a disease, and what you can do to prevent obesity. This brings me to my first point: what exactly does it mean to be obese? Defining overweight and obesity, according to the CDC, overweight and obesity are labels for ranges of weight that are greater than what is considered healthy for a given height. The terms are also to identify ranges of weight that have been shown to increase the likelihood of certain diseases and other health problems. So how do you determine if someone is obese? Obesity is determined by using weight and height to calculate a number called your body mass index, or BMI, and is defined as a BMI of 30 or higher, whereas normal weight is between 18.5 and 24.9. BMI is mainly used because it correlates with the amount of body fat one has, but does not directly measure one's body fat. Note that not the ideal way to measure one's amount of body fat, as it does not take into consideration muscle and bone density. Other ways of estimating body fat and fat distribution are skin folds, waist to hip circumference ratios, bod pods, which measure body fat and lean muscle mass, and DEXA scans, which measure bone density. Now that you know what obesity is, I will explain why it is now classified as a disease. So why did the AMA classify obesity as a disease? Obesity is a major public health problem. According to the AMA website accessed on July 17, 2013, obesity contributes to 112,000 preventable deaths each year. The website also states that the prevalence for obesity has dramatically increased from 13% of adults in 1980 to 34% of adults in 2008. Among children, this prevalence increased from 5% to 17% during the same time frame. Some conditions that increase in risk as a person's weight increase are coronary heart disease, type 2 diabetes, certain cancers, hypertension, stroke, liver and gallbladder disease, sleep apnea, osteoarthritis, and could even cause infertility. The main aim of this decision to classify obesity as a disease was to get doctors to tackle obesity as if they were treating a disease instead of a lifestyle condition in need of modification, as obesity affects 1 in 3 Americans. In an interview with CBS News on June 19, 2013, Patrice Harris of the AMA stated that the AMA is committed to improving health outcomes and reducing the incidence of cardiovascular disease and type 2 diabetes, which are linked to obesity. According to my audience analysis, only 30% of students knew the difference between type 1 and type 2 diabetes. Diabetes is when your body causes your blood sugar levels to rise higher than normal. Type 1, which is often diagnosed in children and young adults and only affects 5% of people with diabetes, is when the body does not produce insulin to regulate your blood sugar. Type 2 diabetes, which is the most common form, is when your body does not use insulin properly and therefore cannot regulate your blood sugar. The AMA also thinks that by classifying obesity as a disease, Americans may realize what unhealthy eating and inactivity could be doing to their health. With obesity now being a disease, there are also insurance benefits such as bariatric surgeries now being covered by insurance, as well as drugs used for obese patients. My last point is what America can do to prevent obesity. Located on the AMA website are healthy eating and physical activity handouts to help you lead a healthier lifestyle to prevent obesity. Some of the things listed on the healthy eating handout are: provide an array of healthy foods in the home and include them in every meal, eat healthy foods and choose smaller portions, don't keep a lot of junk food at home, and do not use food as a reward. Some of the things listed on the physical activity handout include: view being active as a daily part of life, make being active fun rather than a chore, and don't allow your children to watch TV or play video games for more than 2 hours a day. As we wrap things up, I would like to recap on some of the important points. Know what is classified as being obese. There are health risks and factors that come along with the disease, and know some key things on how to prevent obesity. Obesity is a result of lifestyle choices and can be prevented. Maybe now, since obesity is classified as a disease, Americans will take their health seriously and make some changes. Now you are educated on obesity and some of the decisions as to why it is now classified as a disease. Thank you.